LBC at 7:03.
LBC 97.3. Call 0845 6060 973. Text 84850. Saturday Night Live with Dan Wootton standing in for Richard Arnold.
Great to be with you again here on LBC 97.3. We've got a very, very busy show coming up, talking Dancing on Ice this hour and Jason Gardiner. And then next hour, I want to hear from you about celebrities smoking in public. This is, of course, on the back of Kate Moss going on the catwalk with a fag in her mouth this week. 0845 6060 973 is my number. We're also in the next hour talking to Hayley Westerner. She's the world's biggest selling soprano, and she's heading to New Zealand to host a big charity event for the Christchurch earthquake with Prince William. Interested to hear what that's all about. Plus, in the 9 o'clock hour, I'm going to be going head-to-head with Steve Brookstein. He's the first winner of the X Factor, and he's got a beef with Simon Cowell, so look forward to hearing from him as well. I've got Amy Brookbanks in the studio with me. She's the celebrity writer for Sky Magazine. Good evening, Amy.
Hi, Dan.
And we are talking Jason Gardiner this evening in this very thorny issue of male celebrity baldness and whether these blokes who are on the tally should be spending £12,000 to get a full head of hair. That's something that Jason Gardiner's doing at the moment. That's why he's been wearing this cap on Dancing on Ice. Do you reckon that's vain? Or do you think actually it's fair enough because there's so much pressure now on male celebrities to look as good as female celebrities? Now I'm joined by an expert on this issue, Dr Bessam Farjo, who is the founder of the Farjo Medical Centre. And Dr Bessam, thank you so much for joining me this evening. You're obviously someone who knows a lot about this, a hair transplant expert. What's your view on Jason Gardiner having this hair transplant? Any hints as to what procedure he might have gone through?
Most likely he would have had a procedure where hair roots are taken from the back of the head where they grow permanently, and then they are dissected down to the natural groupings that they occur on the scalp, and then they are transferred to the area where he's lost hair from. That is the most popular form of hair restoration or hair transplantation, called follicular unit transplantation. And at the moment, there seems to be quite a momentum in the amount of information available through the internet, through the media, through celebrities, making the operation extremely popular at the minute.
Yes, it does seem there are many, many more celebrities, male celebrities, who are going under the knife as such, because it is a surgical procedure, isn't it?
Yes, it is a cosmetic surgical procedure. Having said that, it is a procedure that's done under local anaesthetic. So, this doesn't involve hospital admission and all that.
Is there much risk?
Well, it's an operation to the skin, so there isn't any risk to vital organs or risk to life, if that's what you mean. But there are certain complications. Obviously, there'll be a little bit of discomfort after the operation in the scalp for a few days. There's always the risk of infection, but that is very, very rare. But other than that, it's a very safe operation.
What about scarring? That's something that I've heard, and obviously if you're a celebrity, that's a pretty big concern.
Well, the way the operation is done, you're going to have some form of scar at the back of the head where you expect the hair to grow. So what happens normally is you'll have a very fine scar in the area where your hair is growing at the back. But at the top where the scalp receives the hairs, if the operation is done properly, there shouldn't be any form of visible scarring.
Now, the point our last caller was making, who used to work as a hairdresser in this area, he was saying that the problem is that you never know how much you're going to recede, so you potentially need to have transplant after transplant after transplant. How do you get around that?
I think in the old days, in the older techniques of transplantation, all the techniques of transplantation, you used to need to have definitely multiple operations. But nowadays, the operations are quite large. In one operation, we can transfer thousands of hairs. So if you choose the right candidate, obviously if you choose somebody who's young and just beginning to lose hair and they have a strong family history of hair loss, then you could enter into a bit of a disorganized plan and you end up having multiple operations. But it's the right candidate who is sort of reaching stability with their hair loss, then you could plan it properly, and somebody could end up having maybe 2, at the very most 3 operations over their lifetime.
Now, Jason Gardiner's been wearing this hat on Dancing on Ice for a number of weeks because it looks like the hair hasn't come through yet. About how many weeks does it take before, from the operation, from the surgery, till he will have, I guess, a more normal full head of hair? About how long does it take?
It takes a long time. I mean, once you have the operation, it could take maybe about 4 months before you see any sort of any form of finer growth. But to get a full result, for somebody to look like they have the full thing, it could take months, maybe 8 to 12 months before they can see a full result. So if somebody like him is about to show a full result of a transplant, he must have had the operations months ago.
Interesting. Do you think it's more common for celebrities to have these operations than ordinary blokes?
I think celebrities obviously make the headlines and bring it to the public eye, but certainly not. I mean, you know, if somebody like myself, who's in full-time practice, only relies on celebrity, we're not going to do many patients. But no, it's a very popular operation. Many people are having it done. It seems that celebrities are having it all the time simply because they make the news. And
£12,000 is a lot of money. I mean, is it ever more affordable than that?
I don't know how much he paid, if that's what it says in the papers, but certainly it should not cost that much. The average operation that people pay at our practice is more around the £8,000 rather than £12,000. But well, you have to appreciate this kind of operation mostly lasts all day, so the patient is in there several hours because it's a very painstaking operation involving transfer of thousands of these hairs. To make it look natural, it has to be done very patiently and very accurately.
Absolutely fascinating. Dr Bessam Farjo, the founder of the Farjo Medical Centre and an expert on hair transplants. Thank you so much for joining us. I guess I have a bit of an interest in this, feel that I'm thinning out a little bit, so I have sympathy for Jason Gardiner here. Tell me what you think on this. Do you think Jason Gardiner should have spent £12,000 to give himself the opportunity for a full head of hair on the telly?